This is how we remove tumors from the cerebellum. It's called a suboccipital craniotomy, and this is how we do it. After we fixate the head with a skull clamp, we make our incision at the junction of the cranium and the cervical vertebra. The muscles are carefully identified, and we have to peel them away from the cervical vertebra in order to identify the bony landmarks as well as the junction of the skull. We peel the muscles away and we keep it in place with a self-retaining retractor. The outer covering of the skull, called the pericranium, is then removed. We then use a high-speed drill to strategically place burr holes where the opening of the skull is going to be. Once the holes are made, we switch our drill bit to a different type of drill in order to create that window in the skull. Once the skull flap is removed, there is this protective layer covering the cerebellum. Comment if you know what it's called. We open up this protective layer to visualize the cerebellum and the brainstem. Sometimes we need to remove the back part of the C1 vertebra in order to get a clear picture of what's going on. Once everything is adequately visualized and identified, we can then remove the tumor. This animation is a gross oversimplification of the process that actually happens when we take out the tumor. Once the tumor is out, we then place this synthetic